All right, that's much better. All right, welcome everyone to our webinar on snakebite and envenoming in pets, in human and pets. Before we start, okay, I would like to remind every single one to please mute your microphone and your video. Only the speakers will be speaking with the mic on and also the moderator, all right? And this webinar will be recorded, just for your information, all right? And there will be an e-cert given by the end of this webinar. But there will be 3 questions asked before you can get your certificate for it. Okay, so I would like to invite our first speaker, and I'm very, very honored to have him with us. He's Dr. Ahmad Khaldun Ismail. He's an associate professor and consultant emergency physician in the Department of Emergency Medicine, Hospital Chancellor Tuanku Muhriz, Universiti Kebangsaan Malaysia Medical Center. He is the president of the Malaysian Society on Toxinology since 2013 and was a review advisor for the WHO Snakebite and Envenoming Working Group from 2018 to 2019. He is the founding consultant of Remote Envenomation Consultancy Services and founding director of ASEAN Marine Animals and Snakes Envenoming Poisoning Management, ANSEM. His special interests are in clinical toxinology, emergency medicine, and pre-hospital care. He founded various educational programs related to clinical toxinology for the public and healthcare professionals. He's passionate about teaching and is a well-known speaker in Malaysia and internationally. He holds the authorship of a number of academic publications in related areas of interest. He enjoys traveling, nature, swimming, and a good coffee or tea. So let's welcome Dr. Khaldun.
Thank you, Melissa. I hope everyone can hear me. So I'm going to start. It's going to be a very short presentation, just to give you an idea of how the current situation of snakebite in our country and how we manage snakebite in the recent years. I hope you can, let me see if I can enlarge this. Okay, can you see the slide? Yes, okay. So what we have learned so far in the recent years that snakebite is not just a Malaysian issue, okay? So it is actually globally, it's a issue with countries with low income, or what you call developing nations, and mainly in the tropical belt. So it is a crisis, for example, in Southeast Asia, mainly in India, for example, Indonesia maybe, and also Africa. So there are many cases where it results in death. So in Malaysia, we also have. Can you, Melissa, can you respond? Are you able to see my slide?
Dr. Khal, we lost you just now.
Oh, okay. Are you able to see my slide now?
No.
Okay, let me see if I can share. Now, what about now?
So far, it's still blank. Okay, now we are good.
Okay, so just take on that snakebite is an issue worldwide. So we are actually seeing death and also injury from snakebite, and not just in Malaysia, but also globally. So in other parts of the world, there are actually what do you call places where they develop antivenom, and these antivenoms are actually meant for that particular country and that particular country's species of snake. So what we have recently, WHO has announced that snakebite is a neglected tropical disease. So many people in the developing world are actually having problems of obtaining medical care, and that is also one of the issues whereby a lot of people suffer from snakebite. So WHO has come up with what we call roadmap in managing snakebite, and they come up with these 5 pillars, basically community engagement, health system issues, safe, effective, affordable antivenom, treatment and recovery, and also global connection or global networking in dealing with snakebite. So what about Malaysia? So where are we in this situation? So basically, we are actually have not just one species of snake, this is the Malayan pit viper, very famous, but not all of Malaysia has this species. So we have a lot of other species that can cause injury to humans. So let's take a look. If we don't understand the problem and acknowledge the problem, we will not see the issues. So that's how snakebite becomes neglected. In our country, so far, Alhamdulillah, very good that we have good medical system, good health system. However, some funding regarding snakebite or snake research are maybe not that easily obtained. So this indirectly also may affect how we obtain our antivenom. In the past, people stock antivenom from inappropriate countries. For example, this one, it was obtained from India, but we don't have any of the species in the antivenom that we buy. So it is cheaper compared to other countries' antivenom, but it is inappropriate. Okay, so money is not just price is not the only problem. Okay, but most importantly, I think our population, our people, our healthcare providers are not really aware about the updates in managing snake bites and what are the current evidence that we have in order for us to provide the best care for snakebite patients. So we do see, even until today, that some old practices or even in by the doctors practicing medicine, providing inappropriate management and treatment to patients. This also includes in the public where inappropriate first aid being done. So the example is like this. In the past, people suck the wound. You've heard about this. And now they even develop a modern tool to suck the wound, which is actually inappropriate and wrong. So sucking wound is not appropriate first aid. The most common first aid that we see in Malaysia is people tying the limb or tying the fingers where it was bitten. So, or what we call tourniquet. So this is very, very common practice throughout the country. So these are all inappropriate first aid treatment. And when the patient reach the hospital, sometimes the doctors or the healthcare provider or professionals are not well versed about managing snakebite. So they develop or they provide treatment that result in failure of therapy, and also may worsen the complications of snakebite. Okay, so this is one example. In the past, a lot of people, the doctors in the hospital, think that if you are bitten by a snake, the limb are swollen. So the treatment they do is to cut open the wound. Okay, this is called a fasciotomy. But nowadays, from our evidence and research and also modern tools, we do not need to perform fasciotomy because we have the ability to see where the swelling is and also where the problem lies in snakebite. So surgical intervention is not the first line anymore. Antivenom is now the first line of therapy. And we see that when we give appropriate antivenom to patients, the patient doesn't need to go for that kind of very, scary looking surgery. So we also develop emergency care in Malaysia quite well. It's one of the youngest specialty in Malaysia, emergency medicine. But we have seen that in order for us to provide the best care for patients, we have to be as strong as our weakest link. So we have to make sure that every part of patient care, from before arrival to hospital, in the community, until they go home, this what we call chain of survival are strong, and they have to be complementary with each other. So that's why our doctors and healthcare providers in Malaysia require appropriate knowledge and training. And this is basically to allow them to adequately assess the patients, to diagnose the condition, and also treat patients. And not all patients require the same generic treatment. So we need to determine which patient require the appropriate treatment. For example, antivenom, not all patients require antivenom. Okay, only those who are indicated for antivenom will be given antivenom. So appropriate clinical care and support for these doctors is also important. So we cannot just ask them to read books and believe that they can provide the optimal care to patient. So we need to provide the support also for the healthcare providers. And this is actually now in Malaysia since 2012 is provided by what we call consultants in the remote and Envenomation consultancy services, or in short RECS. So RECS is now not just in Malaysia, but also providing training and support for ASEAN. And RECS is actually parked under the auspice of the Malaysian Society on Toxinology. Not toxicology, but toxinology. So MST has been around for a long time, since 1992, but RECS is only established in 2012. So currently we have 11 consultants throughout Malaysia, and all of them are currently consultant emergency physicians, and they are all with special interest in clinical toxinology and members of MST. So what we provide is a 24 hours voluntary on-call for the doctors managing snakebite patients or patients with issues with clinical toxinology. So it's not just about snakebite. So we have other issues with toxins, such as from jellyfish sting, from scorpion sting, from hornet sting, for example, or even poisoning from what do you call poisonous fish or poisonous plants and mushrooms. Okay, so these are all part of toxinology. So RECS is mainly concentrating on envenoming, but we are actually part of a movement that trying to make clinical toxinology as a subspecialty. Okay, so what we have done over the years is that we have streamlined all our clinical management, and we provide, we help the Ministry of Health to come up with our own local guideline for snakebite. And this is actually based from the WHO guideline for snakebite in Southeast Asia, but we have tailored it according to our needs in Malaysia and our services in Malaysia. So because we have our own species of snake and our own problems. So we have also provide the support for doctors at every level of patient's care. When the patient arrive to hospital, even before arrive to hospital, the doctors can call us, RECS, and we can help manage the patient from the time patient arrive until the time when patient is allowed to go home. We also come up with a support where we understand that not all doctors know about snakes in Malaysia. And the same with me. Before 2009, I have no idea what are the species of snakes that we have in our country. And I learned from mistakes. And therefore, I think that support, like, image gallery of all the species that is dangerous to us in Malaysia should be actually at least made known to our healthcare providers. You don't have to know all the snakes, but these are some of the examples of the dangerous snakes that we have in our country. And this book is available online. Our moderators will share with you the link for the book. And this book is actually made from our collaboration with MIBIS, or Malaysian Biodiversity Information System, which is based in the Ministry of Natural Resources in the past. And we have formed this alliance in 2017. So we come up with this, our first project, which is the book that you saw just now. And currently we are also embarking on big data, where we record all the REX consultation into a systematic registry, and each individual cases will then allow us to analyze, and this various information can be used for streamlining our services, okay, and also provide a lot of insight into how patients with snakebite is being managed in our country and how we can improve it. Okay, so MyBase has actually start documenting our consultations from REX since 2015, and as you can see, from 2015 until 2017, our cases for snakebite, our consultation has been increasing over every year, and the most of the cases are actually from snake-related injuries. This is a data from 2015, and an example of data how we can interpret is that we can tell from the REX consultation which states in Malaysia has the most number of snake bites. For example, in this one from 2015 and 17, Pahang, the state of Pahang, has the highest number of snake bites, and followed by Sabah and Sarawak, which is in the past we didn't know that Sabah and Sarawak has a lot of issues with snake bite. But now with this data, we can see that which states that frequently contact REX to consult about snakebite. And so far, from 2015 and to 2017, we only recorded 2 deaths. So that is actually very, very good outcome from our healthcare service. So I would like to compliment our healthcare service, our Ministry of Health, for providing such a good service, and also providing the necessary support, for example, the appropriate antivenom in our hospitals. Okay, so that is very important. That's why, and that's how we managed to maintain our mortality rate very low for snake bites. So this is an example of what clinical toxinology consultation that we have seen just now was until 2017. But 2018, as you can see, the number has now shot more than 1,000 cases per year. So 2018, 1,073, 2019, 1,027, shy of about 50 cases, but it's more than 1,000 cases that we been consulted for every year. And of this, snake-related injuries are the most common reason for the consultation. So within these 3 years, 2017 to 2019, Sarawak has now topped the list, where Pahang is number 3 and Perak is number 4 in terms of total number of cases within that 3-year period. So this is an example also how MyBase data can help us streamline which actually the snake species that is commonly cause injury to patients. So from this data that we gather from 2017 to 2019, it shows that the venomous snake, this is a picture of a venomous snake, the top 6 venomous snakes that is identified and cause harm to our patient consulted to REX. The first one is the green one, the green bar, and that is the Naja sumatrana, that is the cobra. So the second one is the red color, which is the other cobra, the Naja cautia. So the rest are actually our pit vipers, and some of it are mainly, for example, the Trimeresurus purpureo maculatus and what we call shore pit viper, and the regular pit viper. These are confined to Peninsular Malaysia only, whereby the Tropidelemus subannulatus or the Bornean pit viper, Bornean keel pit viper, is only confined to Sabah and Sarawak. So these are the list of from the data that we gather with MyBase. This is how the output that we can have. So this is very nice representation and how we can actually help our hospitals prepare themselves with the appropriate antivenom. So these are just representative. Some of you may never seen this species before. So these are the top 6 venomous snakes that we have recorded causing harm. The number 1, the A, is the spitting cobra or Naja sumatrana. It's available both in Peninsula Malaysia and also in Borneo, Malaysia, and Sabah Sarawak. And the B is the Naja cautia or monocle cobra, just confined only to the northern part of the Peninsula Malaysia from Selangor up to the north. Whereas, like for example, Johor is not indigenous for Johor. It's not
Dr. Khaldun, we have lost connection with you.
Hello, are you okay? Can you hear me now? Hello?
We can only hear you now. The past 1 minute, we lost you.
Okay, was it until the, can you see the picture now?
Picture, yes, clear.
Okay, so did I speak this picture? Can you hear, or this slide?
This slide halfway.
Okay, just to
This slide, yes. You
okay.
finished this slide.
Okay, we finished this slide. So these are just to show you the image of the cobras and also the pit vipers, the 6 topmost snake species that we have in our country, causing harm to Malaysia, to our patients. So what is next? So we actually now embark on a project to provide a mobile application for public and also our doctors. So this is now the next generation for consultation. So can you hear? Just a short video.
Yeah, we are losing you. Okay.
Okay, I think I'll move on. Can you hear me now? Hello, can you hear me now?
Yes, we can.
Yeah.
Okay, so I think I'll skip the video. So that is actually just another project that we are doing with actually for Snakebite in Malaysia, providing an app where people can consult and also uh, 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 look at the information about Snakebite. So another next step is actually moving on to generate networking among our ASEAN countries, and this is in the form of AMSAM, Fellowship in Clinical Toxinology, and also Pan-ASEAN Antivenom Consortium. So these are our next project, still in the pipeline. So we hope that we will be able to, make it a reality. So with that, I thank you. So I give the mic back to our moderators.
All right. Thank you, Dr. Khaldun. Okay, just a little bit of housekeeping announcement. Participants, please be reminded, you have to mute your mic. And if you like to, you can still on your webcam. All right. I just need to let you know that there's a chat box over there. You can use the chat box to ask relevant questions to the speaker. Norsham and I will actually direct the questions to the respective speakers. All right. The eCert will be shared via Google Form link at the end of the webinar, but you have to answer 3 questions before you can get the cert, and the link will be available until the end of the month. Okay. So now, next, I would like to introduce Dr. Taksa Vasaruchapong. He will be joining us from Bangkok. All right.
Hello.
Hello. Yes.
Let's try to share my screen.
Yeah.
Okay. Shall I start out or any introduction from moderator?
Yes. Yes, just hold on.
Okay.
I was looking for your CV. Hold on. Okay, let me introduce Dr. Taksa. Dr. Taksa is a veterinarian on snake farm from Queen Salvaba Memorial Institute. He takes care of snake health management program in snake farm and performs researches in snake medicine and snake venom. He has worked as a consultant for reptile medicine in other veterinary hospitals and given lecture in veterinary schools. He became interested in snake bite management after he was bitten by his patient, a monoclade cobra, and lead him to participate in snake bite workshops and conference. It's a very interesting introduction. So I'll let Dr. Taksa have his talk now.
Okay, thank you, Melissa. Okay, so as the introduction, actually my main responsibilities will be about snakes. I will take care of snake health, keep it live well, and keep eating, and biting, keeping the venom, something like that. And about the treatment in pets, I'm mostly involved in terms of consultation from the West Hospital. And there are some issue about the antivenom treatments in veterinary medicine. Because even in Thailand, when we talk about snake bite problems, we have only just overview of the venom from the snakes, and many of us believe that if the snake bites the dog, you just give the antivenoms. If the antivenom works, the dog will survive. If the antivenom doesn't work, the dog will die. But in fact, it's not. We still have a long way to develop our knowledge about the snake bite envenomation. If we compare to the human medicine, we still have many things that interest us, and we can move forward together. Okay. So around my topic today is antivenom treatment in pets and obscure treatment in veterinary practice. I said it obscure because it's unclear. Okay. And many problems will happen when the dog confronted with the snakes. I think some people will used to came across these problems. It seems like dog and snake is always fighting. Actually, the snake is a little bit afraid of dog. And some dog try to kill the snakes, and some dogs try to just play with them. But they have no idea that the snake has a capable of fatal venom, so they can kill them by envenomation. So, and a lot of this situation happened, and then the snake died. The dog got bitten, and then the dog died after the snakes. So the problems of the people in our region is even the owner has no idea when the snake bites the dog, what should they do next, and also the veterinarians, how to diagnose and how to treat the dog that has been bitten by snake. So the first thing we talk today is how to do when your pets are bitten by venomous snakes. I mostly get lovely photos from the website WikiHow, and I pick up some interesting one and try to arrange it as easiest way to understand. Okay, so the first thing is when the dog got bitten by snakes, the first thing for the owner is to try to remember all symptoms that the dog show to the owners, because one of the weakest points in the veterinary medicine compared to human medicine is the patient himself cannot tell the doctors. We cannot talk to the dogs. So, and mostly the owner see the dog after the dog is already collapsed or has something abnormal. So the best way of the owner is to recognize as much as possible to every symptoms that the snake show before its collapse. And the second thing is the owner should not try to find the snake by themselves, because they can put themselves into a danger, like find the snake and then got bitten by the snake too. So both the owner and dog got bitten, that's not a good idea. Okay. But if you find the snake, it is not encouraged to kill the snakes. Okay, I am the veterinarian. I work with the snakes. I'm not encouraging people to kill snakes. But one thing that we can do is the mobile phone. The mobile phone can take a photo of the snakes, and it's pretty helpful for the identification of the snake that bites our dogs. And when you want to move your dogs, you're supposed to use the soft blanket or towels and put the dog in to easily move it and make it less movement. The next thing is the pressure bandage immobilization. This is quite well established in the human medicine, but until now, there's still no evidence that it has a benefit on dogs or not, but it's believed to have the benefits too. Because we believe that the venom absorptions would due to the muscular contraction. So if you just soft tissue bandage, pressure bandage with the sprit to make the bitten areas immobilized or less movement, they can slow down the venom absorption. This should be helpful. And Dr. Khaldun also mentioned about this: do not suck the wound. Okay, so do not suck your dog wounds. Okay, and reach to the hospital, to the veterinary hospital as fast as possible. So this is how to do when the dog got bitten. And when the dog reached to the hospital, the first question that always happens is, which snake bite your dogs? And that snake venomous or non-venomous? And this is a problem. There are several ways to identify that the snake that bites your dog is venomous or non-venomous. And this is the unupdated photos from WikiHow also, but actually this website already removed it. It's not up to date. In the past, many people believe that the swimming posture of the snakes can tell that is venomous or non-venomous. The head shape, the shape of the pupils, and also the coloration of the snakes. But in fact, some of this information may be helpful in some country that has a few venomous snakes. But if compared to our region in ASEAN, we have more than 60 species. Just only in Thailand, more than 60 species that are venomous. So the pattern like this does not work well. So we should recognize one by one. And a lot of people say that, how about the fangs? When you see the snake, if the snake has a fang, it's will be venomous. Actually, some of that information is correct. So let's see the photo like this. If we see the snake in this way, you can tell that this one is venomous because it's showing you the fangs. But this one has no fangs, so it's not venomous. Correct? But in fact, it's not easy like this. When you see the snake in the real life, no snake crawl in front of you and then say cheese to show you that fact. So it's not work on that way. So let's see the real things. So these photos show different types of the snake tooth formations and also including fangs. The picture showing here is 3 of them that has fangs. So that means 3 of them can classify as venomous. So here, this one is a banded crate. So it has a small fangs, so we call it short fang. It belongs to the family Elapidae. So the short fangs located here. A few people will feel like it's an acne on your face, something like that. So it's just a bit small. And here, this is a Malaysian pit viper that Dr. Khaldun mentioned causes lots of bite in Malaysia, and this causes lots of bite in Thailand also. As this one shows a fang, obviously, because this snake has the problem of gingivitis. This has infection on the gum here, and then they lost the fang sheath that covered the fang, so the fangs show off here. But if in the real position, the fangs will look like this. So it can flex and keep on the upper part of the outer cavities. Okay, and here this one has a fang located back here, so called back fang, but actually it's still a long way to go about the back fang classification of non-front fangs. There are some will have potent venom, some are not. So, but anyway, this one classified as non-front fang, so it still have fang. Okay? And this one is not venomous. I show you this picture because even a lot of people say that the venomous snake has fang. It's true, but if you never see the fangs, it can lead to misdiagnosis or misidentification. So the best way to identify the snake in our legion is to recognize the important one by one. And the book that Dr. Khaldun showed you will be helpful to identify. But one thing that has to be precaution is about its similarities that we show you later. Okay? And it is a full tooth formation of the snake. So the important one is on this side in the late coloration, the corporal fiber. There is sharp fangs and mostly contain the neurotoxic. So, but anyway, it depends on different part of the world. Okay, and here, this one we call solinoglypha is a long fangs. In our countries, we find it in viper. Here, this is just some examples that some snake that look like venomous one, but in fact this one is non-venomous. It's here, it's called the wood snake here. And this is the Malayan crate, the Bangladesh candidus. So they share the pretty similarities of the color pattern. They can lead to confusions when we confront with the snake, or when the owner kill the snake and bring the snake to you. It can make you confused. And also this one is examples. On this side, this baby of freshwater snakes, you know, and here is a baby of king cobra. Yes, the king cobra babies will change its coloration when it grow up or is reached to puberty. So you can see that when it's a juvenile, it's look alike on its patterns. So and also this one is juvenile Russell viper. Anyway, Russell vipers may not be found in Malaysia, but in Thailand and Indonesia. Yes, the Russell viper here, and this is the dog-tooth cat-eye. So it's Boyga species. So this one is important venomous one, and the pattern is what look like. So even you have the book or has a photos on your hand, sometimes it's very easy to miss identification. My suggestion is to take the photos, and you can send to someone that is reliable on identification, like Dr. Khaldun mentioned about Rex. In the human medicine, we can send that photos for consultation, and then you can get the answer back and much more easier to identification and easy to diagnosis and give a proper treatment. So in the veterinary medicine also can do that. We can gather and found some source of reference to identify the snake for your treatment. So it's also helpful. But anyways, don't do like this, okay? When you take the photos, please get good photos for identification. I cannot see anything, just even for the flush inside the toilet in these photos, okay? Or even like this is well not helpful. So for my suggestion to take a photo of the snake, if the snake is already got killed by the owner, you can take several shots of the photos, bird part, bottom parts, and close up to the head or tail, or the part that look like is different from the other part, and send along. Here it is a Facebook of the snake farm or the emails. We can send the answer back to you. Okay, now we will go much more into the clinical talk about the venomous snake. In Thailand, the common venomous snake that causes the bite is these three in the veterinary medicine. That is white-legged pit viper, Trimeresurus arbolabis, Malayan pit viper, the Caloslasma rhodostoma, and the monocle cobra, the Natacatia. Actually, we share the same species between Thailand and Malaysia, and also in Indonesia. The Indonesia also has the arbolabis. Okay, so the antivenoms that produced by Thailand also has some benefits on the snake in the neighboring country also. So, and this is the overview of the clinical side that we can find in each snake bite. Like the white-legged pit viper envenoming, there's mostly cause low mortality rate. I think many veterinarians may came across this one. They mainly cause really painful and swelling. The dog will feel a little bit bad and make the owner feel uncomfortable with that swelling. It will take up to a week or 2 weeks and it subsides. normally has low mortalities. So sometimes usually the analgesia to control is to be okay. But anyways, in the vet practice, we normally not has a close monitoring on about the coagulation of the blood profile. And one thing that has to be mentioned that different from the human medicine is normally the people we got the human got bitten at hand or the foot, but the dog is mostly at the face because it reached the face to bite the snake first. And then the snake bites back and then has a face swelling. So it looks like this. The point that should be concerned is about the swelling until the compressed trachea or the upper airways obstruction that maybe need to intubation. So we'll talk about this later. And on the Malaysian pit viper, the Caloslasma rhodostoma, this causes a lot of bite in Thailand and also in Malaysia. This snake cause more local damage. Okay, they can cause some ecchymosis and to get necrosis on the pets also, on the dog. Okay, and many cases lead to coagulopathy that need the antivenom injection. Okay, and the other thing is the supportive treatment like analgesia and care are so important.
I'm having my eyes see.
The monocle cobra is also one important in Thailand. It's caused the highest mortality rate. The many dogs that fight with cobra during the night will collapse and the owner is unnoticed and then the dog pass away during that night. And many cases happen like that in Thailand with a cobra. And it is also possible in almost any part of Thailand and also in Malaysia. But in Malaysia has more Naja sumatrana or the spitting cobra, but the clinical side is pretty lookalike because Sumatrana may cause more tissue damage. Okay? But the important point of cobra is a systemic paralysis and then lead to respiratory failure and also cause the tissue damage. So the treatment would be the antivenoms and symptomatic treatment. These are videos of some symptoms of the dog that was bitten by cobra. This one, the owner found the dog fighting with the cobra. Yes, and after a few hours, the dog start to have a salivation like this, or sometimes in vet practice we call tyrelism or hypersalivation. Actually, this thing happened because of its dysphagia. It cannot swallow the saliva in, and then the dog try to chewing and make the saliva become frothy. This is one of the symptoms they can find after the dog envenomated. So, how about the treatment? The treatment of the snake bite in pets, mostly we talk about two things. Is the specific treatment. That's only main specific treatment, or the most effective way is the use of antivenoms. And the second thing is symptomatic treatment. That also important. So what is the antivenom first? The antivenom is a hyperimmune serum from the horse. Okay, we produced by immunized hospital venoms. And nowadays, the Thai Red Cross can produce 7 monovalent antivenoms, that including here is king cobra, here is the white pit viper, the Russell viper, banded crate, Malayan pit viper, monocle cobras, and Malayan crate. That is monovalent. The monovalent antivenom means you have to use specific to the snake species. Okay, like you got bitten by cobra, you need to use a monovalent antivenom of the cobras. And we also developed the polyvalent antivenom here on this side. We separate as a neuropolyvalent snake antivenom. So it can use on 4 species that has neurotoxin, and hematopolyvalent snake antivenoms used on the 3 species of hematotoxin. The way we produce the antivenom is we extract the venom from the snake first. And when we got the venom, we will process the venom and immunize it into the horse by injecting the venom in. okay, at a sublethal dose. And then the host can develop the antibodies against the snake venom. Then we check the titer, that the titer is high enough as our standard, and then collect the host blood and set with plasma and to use as antivenoms. We have more processes on this, but it's just really a brief overview of how to produce antivenom. Well, the indication for antivenom is well established in the human medicine. Like here, this was published on the WHO recommendation, like any symptoms that indicate here, like hemostatic abnormality, like systemic bleeding, coagulopathies, or here 20-minute whole blood clotting test or elevate PT. That is an indication to use antivenom. Also, other neural symptoms, ptosis, external automopagia or paralysis. And here is the list of the symptoms that you're supposed to inject the antivenoms. But anyways, if you compare to the veterinary medicine, we lack of clear indication impacts because we don't have the complete data collection and about the data analysis. Some of the examples that we can find is to develop. Sorry, my baby trying to talk to me. Okay, okay. For some example, this in Australia. In Australia, some publication also was published about the clinical feature on mainland tiger snake envenomation in dogs and cats. This will be very useful. I want to show as examples. From the retrospective studies, they can have a list of the symptoms they can find this one in the dogs. Okay, and most symptoms that we can find here, the limetriasis, the reduced pupillary light reflex, ataxia, dyspnea, actually is pretty look like the human also. Just list something that's different like the tigerism and vomiting is not much in the human. Okay. And in Australia, the snake has both neurotoxicity and hepatotoxicity, so we also has the problem of coagulopathy. And then we compare to the cats. This publication also talk about cats, and they also display pretty the same, the clinical side. So if we have the data like this, we can pick up analysis and use this as one of the indication to inject the antivenom. But for now, I think it can compare to the human medicine, like any systemic envenomation show we can decide to inject the antivenoms. And the antivenom treatments has precaution that do not use antivenoms in dog that showing no clinical sign. So it's not, because when the snake bite, they can control the venom gland, they can control the muscles, they control the gland. So it doesn't mean that every time that the snake bite, they will inject the venoms. Sometimes they don't inject the venoms, so-called dry bite or inadequate venom delivery, something like that. So the snake will show no clinical sign. And the funny thing about this is many people in Thailand saw the dogs got bitten by snake and they don't have the symptom. They said, this dog has superpower, something like that. But in fact, it's not, because the snake not injected venoms. Okay, so it means it's not show clinical sign. You no need to inject the antivenoms. Because if you inject the antivenom without the clinical sign, it will put the patient in risk of antivenom reaction and also waste of the antivenom. That is sometimes is not easy to find and also costly if you use this too much. But the dosage of the antivenoms has no specific, even in the human medicine, because the snake inject different venoms. So the recommendation, even in human medicine, they has an initial dosage, and you have to monitor the patient and repeat the antivenom as is indicated. That also in veterinary that should do. But different states may use a different amounts of the antivenoms. Okay, and the dose also based on clinical trial or have to be collected out the data and see what is the appropriate dosage of the antivenom in each species. Okay, and here, this is the dosage in Thailand aspect. From my experience, many different hospitals use different dosage of antivenoms. The antivenom from Thailand will be like the lyophilization frog. This is a powder that has to be reconstituted by the sterile water, and it becomes the 10 ml per one vials. Some hospitals divide it and inject only 1 vial for one time, and this is not work, the dog die. They said, okay, they can keep the antivenom for use for the next time. That is totally wrong. It's not supposed to be done. Okay, but in Thailand, the standard that normally do is inject stuff from 1 vial. But if the dog collapses so fast, they can increase the dosage of the antivenoms and to 3 vials. Yes, that must do use along with the symptomatic treatment. But when compared to the human medicine, we can see that the human medicine will have initial dosage of neurotoxic venomous snake antivenom start at 10 vials, and hepatotoxic is 3 vials. So it's totally different number of the antivenoms. Okay, even in Thailand, that produce the antivenoms. There is many things that has to be concerned or has to be collect more data on these things, because it have to be concerned about the natural resistance of each particular animals. Like if you can, well, for my observation, like if the cobra bite the mice may die pretty fast. It's maybe in 1 or 2 minutes, the mice can be dead. But if it's bite the frogs, it will be 15 minutes or half an hour. So it's different species can have different resistance to the snake venoms. So and if we talk about dog, it's more resistant than the human. They may need longer antivenom dosage. So, but this one cannot be proved at the moment. We need more data and have to work together to get these data for analysis. And here is one of interesting example again from Southern Africa. They publish new articles of diagnosis and management of snake bites in dogs. They have pretty long time, so almost 10 years collection the data and analyze how to diagnose and what is the dosage recommendation in this publication. You can see that in this publication, they talk about the antivenoms on the neurotoxic snake. Give as much antivenom as the owner can afford. So pretty strange. Well, so the start from 1 vial is better than none, and then increasing, just maximum of 8. So it's value on the money. Actually it's sad, but it's always like this. And here, and for the boom slang, about 1 or 2 ampoules, half-liter 5 ampoules, kaboom, up to 20 ampoules. So it depends, and maybe not related to the human dosage. And one thing is, some snake that is really less bite in the human medicine, like the wild snake in Africa, but there's a lot of bites in pets in Africa because the different behavior. When we see the snake, we not always go to catch the snake at all, just only the accidental. But the dog, when they smell the snake, they will get toward the snake to find the snake, to play with the snake, and they got bitten by some snake that's not supposed to be bite. Okay, and some symptoms happen in different way also. Like here, even in this publication, they always mention that some bite by the cobras because the serious tissue loss. But if we compare in the dogs, some dogs has much less tissue necrosis compared to the human. And he postulates that it's maybe about the fur and the looseness of the dog skin that may make it typical for the venom to deposit deeply to muscles. So it's still, this just want to point out again that maybe some interesting data on the veterinary aspect. So the dose from now, for my conclusion, is we cannot conclude the antivenom usage in the veterinary. We're supposed to start at least 1 vial. at least 1 mile maybe has some benefits and can increase up to the clinical side. You see, like if we talk about the neurotoxic venomous, if the snake symptom is progress worsley so fast, maybe increase the antivenoms. And about the hematotoxic, we're supposed to find some parameters to follow. For now, the clotting time, some coagulopathy, the platelet count, or even the CBC is supposed to be monitoring every 6 hours. So, and after every 6 hours, if the blood remains uncoagulable, is a criteria for repeating the antivenom for the second shot. That's maybe the same amount as the first time, or maybe just less than the first time. But anyway, we start to at least 1 mile. Then continue bleeding, and for the paralysis, it has no exactly guideline, so it depends on the close monitoring also. Okay, and one thing has to be precaution on the antivenom usage. This is adverse effect. This can have a reaction. So every time that you inject the antivenom, you're supposed to inject it by very close monitoring, because you inject the antivenom intravenously. Okay, intravenously, and then if it has some adverse reaction, we should stop and treat the reaction first, and then when the reaction subsides, we just repeat it again, not throw the antivenom away. And how about the other venomous snakes that not in the list of the antivenoms? Dr. Khaldun also mentioned about the bamboo pit vipers or the chaw pit viper, the Trimelissurus maculatus, and equatorial speeding cobra, Najah sumatrana. In Thailand, look like this. In Malaysia, it's black. Okay, so we also have this in Thailand, but why we don't produce this antivenom? Because we use the pala-specific activities, or we also call the cross-utilization. Okay? The pala-specific activity is the way that the antivenom acts across to the other species. So here, there's some studies that are also from the Malaysian team, okay, from the Professor Taniet Hong. He did the cross-neutralization of many cobra from Africa and Asia against an antivenom from Thai Red Cross, that's again from our institute. I found that there is several cobra that can be used for the antivenoms, but maybe a different potency. Like here, the ED50s for the Najah from Thailand, about 22.47, but compared to the Malaysia. Okay, so we may need more antivenoms. But anyway, it's worked well with the Najah sumatranas. So here, if it can protect across the other species, so we call it has paraspecific activity. So it can, so for conclusion, you can use for the antivenom of the monoclonal cobras in the Najah sumatranas, and also use this neuropolyvalent and that is Najah monovalent. So both you can use. And here also the study from 2002 about the cross-neutralization of maculatus is the short pit viper. Also can use the white-lipped pit viper and the venoms. Nowadays we have the hematotoxic polyvalent. It's also helpful. So we can consider this antivenom to treat your dogs. And the other treatment, this symptomatic treatment, do not overlook them, because this is the key to keep the patient alive. Okay, the close monitoring the patient is one of the important factors to make you success in the treatment. The neurotoxic envenomation, the most important symptom is the diaphragmatic paralysis, so to stop breathing. Okay, so the ventilator is crucial to the systemic paralysis. If you can keep the air supply into the lung, the patient can survive. You can wait for the venom to get rid of the bodies. And then they can have, the patient can have the spontaneous recovery. That may take time. The antivenom in the human medicine not always also not prevent the paralysis, but they just shortening the time of the paralysis. And this not have the evidence in the medicine also, but we believe they will act on the same way, because the antivenom will just neutralize the free venom in the bloodstream, not the bowel form. So the biofilm is already attached to the receptors. We need to wait it to release. Okay, so the antivenoms should be given adequately and as far as possible. That should be the most benefit of antivenom injection. And besides, you may need the general anesthesia for intubation. That's different from the human, because the dog will not stay for intubation. You need to make some general anesthesia in case you need to eat. You need to intubation, and this is a prolonged intubation, so they can start from 6 to 12 hours. This is the data from Africa, okay, and it can up to a days, 24 hours, or maybe a little bit longer. So general anesthesia may be required. And when the dog stay on the bed for a long time, you need to maintain IV fluid and regular turning. Okay, so prevent the bed sore. And one interesting thing that I find some report, and this from Australia, from Melbourne Universities, from I'm not sure how to pronounce it, Ong et al. 2015. They found the relation of the snake envenomated by the tiger snake that has immune-mediated hemolytic anemia, or IMHA, after envenomation by tiger snakes. But the cause is still unclear, and maybe not because of venom and not because of antivenom, so it's not clear yet. So it still has to be more investigated. So there's still special things that may be different from the human. And about hematotoxic envenomation, the point is you lost blood, the coagulation factors. So if the patient has a blood loss and continual loss of the fluid, you're supposed to maintain IV fluid or keep the whole blood of the fresh plasma to replace the new coagulation factor back in. Okay, and the one that I already mentioned is the swelling on the face or about the neck area, cervical area, and compressed to the trachea. You may need tracheostomy tube in the upper airway. And sometimes the swelling got so bad, so tracheostomy by the tube may be not enough. You can put in the endotracheal tube inside the trachea here. But anyway, it's need a very good nursing care. And for the intubation by nasogastric tube in the hematotoxic, maybe not convenient to put in directly into the mouth, because when the swelling, it takes several days to subside. And if you put the intubation directly, you may also need a general anesthesia. Okay, so the tracheostomy may be more convenient to the prolonged intubation. Okay, and for adult case here, hematotoxic envenomation, the NSAID is contraindication because the antiplatelet activities maybe make it worse. Okay, you're supposed to use some opioid and morphine or fentanyl. This will be for better choice. So, and along that, my presentation, we can see that we still lack of a good guideline. Now we can just only adapt from different countries and also different from adapt from human medicine. But the different country has different snakes and also different clinical presentation. So each country is supposed to collect the data by their own veterinarians by working together, and then put all of this data analyzed, and you will see that what is the indication of antivenom use in your country, and what is the proper dosage of antivenom in your countries. So that can be different. So, and the way to do this is also retrospective studies. So look back to a lot of data in your hospital, or just look forward by make some complete form to collect the important criteria, important clinical sign, and also monitoring parameters, and then take it, analyze, and finally you will get the guideline. It needs time, but it's worth to do. Okay. I also want to establish this in Thailand, but anyway, it's not my main field of interest. I mainly work on snakes, so I maybe encourage the veterinarian here from any countries to share the information on the form to collect the data, and we can working together, and then we can develop the anti-venom guideline for snakebite in the pet in each country. So, and this should be the last topic for me is about the prevention of the snakebite. So the best way of treating snakebite is not treatment is got bitten. So prevent is not got bitten. Maybe better. So prevention does matter. First thing is manage your area to prevent the snake getting. It's not easy to prevent the snake getting. Okay, but one thing that you can do is clean your area to get rid of rats and also froggies that will trick the snake to follow to eat it. When you clean up your area, it may help on somehow to reduce the snake food, and also cut off your tall grass or the dense bush to make it clear to see when you walk along, and make sure that your dog not got bitten by surprise. And in some particular seasons that has a lot of the snakes, like some rainy season or from the summer get connected to the rainy season, or by the end of the rainy season, a lot of snake will come out. You're supposed to change your dogs or reach your dog, not let it unreached and then go searching in the bush and then got bitten. Okay, so avoid the situation in the risky season or the risky place. And the last thing is snake avoidance training. That I'm pretty interested on this. In Thailand, it's not quite popular to take your dog to school. Okay, but when you take the dog to school, you got something interesting like discipline from your dog's end, and also can prevent some snake bites. I searched this through the internet and see several websites and several organizations that do the snake avoidance training in dogs. This is from Animal Arc. You can search through it, and maybe you can develop your own course to train the dog like this in your countries. Okay, here is the video. It's oh, sorry. I have to go back. Okay. Okay. Just a little bit impressive on that thing. So this dog also learn how to avoid themselves from the snake bite. This will be absolutely benefit on that. Okay. So, and that is my presentation. Thank you.
All right. Thank you for your presentation, Dr. Taksa and Dr. Khaldun. There are several questions from the participants. Ms. Iwan Morsing has a couple of questions, and I think it's all will be directed to Dr. Taksa. She's asking, if we are in the jungle and are bitten by a cobra or a pit viper, what should we do? And if again, when they are in the jungle, how do we minimize the chances of being bitten by a venomous snake? And besides cobras and pit vipers, what other Malaysian snake species bites are likely to be fatal?
That's a human, correct?
Humans, yes, that's only Dr. Khaldun.
Maybe Dr. Khaldun is better person to answer.
Yeah.
I think the prevention is the same as the one with the pets, meaning that you know, wear appropriate clothing, don't walk barefoot when you go out. But I think it's all common sense. Look where you are going, look at where you are holding branches of trees, for example. And of course, as Dr. Taksa said, if you can keep your housing area clean and avoid the pests going around like mice and so on, so that will actually reduce the risk of you getting bitten by a snake. Regarding what are the other snakes other than cobras? Well, we have a lot of pit vipers as well, but the thing about pit vipers are they are you know, staying very quietly in the trees, and their colors are can be difficult to see, and therefore yeah, you can get bitten by them, you know, because you can't see them. they're different from the cobras, where the cobras tend to move away from vibrations, from human activities, but the pit vipers tend to just keep quiet and hoping that you do not see them. But if you come too close, you might get bitten. So that's the difference between the two. We also have the non-venomous snakes that can cause harm. We have the pythons, and we have the reticulated pythons, which can cause quite significant tissue injury, lacerations and macerations, and this can lead to secondary infection and also loss of function or morbidity. So it's actually very
Dr. Kao, we have lost you.
Okay, can you hear me now again?
Dr. Kao, we have lost your answer just now.
Yeah,
Oh,
can you hear me now?
Yes.
Yes, now we can hear you.
Okay, so so again, it's up to the if you look at the ebook that we have, you can see all the potentially dangerous snakes in that book. So yeah, I think Taksa want to add some more.
Yes, about when you're trekking into the forest. I think a moderator, Norsham, also has experience in the jungles. When we trekking in the jungle, actually the snake not likely to attack us. The one thing, the fact is the snake also afraid of the human, as a human afraid of them. So when you're just trekking into the forest, you just walk into the trail, do not reach your hand or any part of your body, seems like a dense bush with unnecessary reasons that you make you think maybe supposed to stay there. So you just will not reach your hand in. And maybe when you walk along into the trail, you wear the long boots and also wear long trousers or jeans that can really help to prevent some bites from the snakes, and also be careful about the branch over your head. But if you will have to go over or it just was under it, so you have to shake it first. Like use a long stick knocking on that to prevent that the snake stay on there and you unnoticed. And about the first aid is also the pressure bandage and immobilization is the only one way that can prolong your time to the hospital. Okay, can give you more time to get a proper treatment. But anyway, it has limitation. Okay, if you're too long time, it's maybe impossible. Is that answer your question?
All right. So I think he answered a few of those questions in there. There's a question from Pavitra asking, are there any first aid measures one can perform if a person or an animal has been envenomed by a venomous snake?
Who answered?
Yeah, you answered. All right. Next one. Sorry. All right. There's a question from Wilson. I think this is direct to Dr. Taksa. What are the first steps to do if we are presented with a case of snake bite, but the owner isn't sure what species is the snake?
Okay, I think this will be the same as a human medicine. So you need observation. There cannot put any treatment when it's not clear. When the dog presents in, and many times that the owner bring the dog to the hospital because they see the snakes, but then it's not bitten by snakes. Or sometimes the dog kill the snake and not bitten by snake. The owner also panic and bring the dog to the hospital. So you can observe the symptom first. And normally the symptoms of the envenomation will show, I think maybe one day, so 24 hours, you can see some symptoms present that. And it's not only the clinical presentation. You're supposed to check the blood. So you check the blood profile. Is the blood profile change? It's going to be indicators. They start having the coagulopathy. That's happened from the hematotoxic. So after the observation, you may have the clue to see that this is the neurotoxic envenomation or the hematotoxic envenomation, and then combine to the data of the snake distribution into an area. That will be helpful on the diagnosis.
All right. So I have a question because related to Wilson. So to Dr. Khaldun, can vets actually contact REX to identify the type of snakes?
Actually, REX is reserved mainly for the healthcare providers or healthcare professionals. So we don't take directly from the public. And that is where our new and upcoming REX application, mobile application, can actually be of help to the public, where there's some information that the public can use to identify snakes and so on. But at the moment, we don't have direct confirmation, direct contact between the RES consultant to the public. Currently, it's all clinical consultations for supporting the healthcare professionals. But maybe in the future, we can actually consider expanding the application to also help the public get in touch with the specialists. But for now, I think in Malaysia, there are so many other snake identification group available on social media, such as the Snake ID Malaysia, SIDM, which is, I think, is very good. And some of the moderators in the Facebook group are actually members of MST. So some of their information are verified. So you can have a look on the social media, Facebook, for the Snake ID, where people in the public, where the public post the picture of the snake, and the moderators in the social media respond to the appropriate species of the snake.
Okay.
So
Thank you.
may I add on this? So
Yep.
I think this I just discussed with Dr. Khaldun this late afternoon. This is maybe better to the veterinarian to form some kind of REX or just a group of people, and we just provide the connection to the herpetologist. They can identify with you. That's maybe the helpful. And besides, it's in the short moment, in this moment, if not in so rush, we can send a photo to Snake Farm, okay? Because as the emails or the Facebook that I mentioned in my slide, we also open for the public to send the photo of the snake in, and our administration answer is every day. So it's maybe not as much as REX, but it will be helpful for identification or somehow.
Yeah, I think what we discussed earlier was that we hope that when we are sharing what we are already doing for human in the sense of managing snake bite and how we deal with this, we hope that the veterinarians can actually take up the next step of maybe formalizing a support group for veterinarians and also for pet owners as well. So we are willing to work together. If you want, we can provide some support and also advice with regards to how it's done through the Malaysian Society on Toxinology. And everyone is invited to join MST as well.
All right. Okay. There's another question from Ms. Lo Simian. For venomous snake, like let's say Naja cautia, it is the juvenile or the smaller snake will have less venom compared with the adult snake?
Okay. So can I answer this? Yeah. Okay. For actually, there's many studies to this, and it's called it intraspecific variation of the venoms. It means that the snake in different age may have a different venom content. So, but if we talk about in the whole picture of the venom, it seems like the juvenile snakes has more potent venom, more strong venom than the adult one. But when we compare to the clinical presentation, it may have less clinical presentation because there's only small amount of the venom that can eject it. So sometimes a lot of the juvenile snake bites is because not serious clinical sign if compared to the adult side. Okay, but if on the lab, yes, it's more strong. But in the clinical, it's less than adult.
And you can also consider that, you know, it's a small snake, the fangs are probably smaller than the adult. So the chance for it to pierce the skin also may be less, and therefore reduced chance for the venom to enter. So that's physical difference.
All right. There's another question from Ms. Lau. Okay. She'd like Dr. Taksa to clarify on why is it NSAIDs contraindicated for hemotropic treatment for snakebite.
Which contraindicate from my slide?
Yes, it's from your slide.
Okay, to back to see all intra.
The NSAIDs. Why shouldn't we give NSAID for?
All NSAID.
Yeah.
Okay, because some NSAIDs has the antiplatelet activities, and when you got bitten by hematotoxic snake, they will act on somehow and consume your coagulation factors, and sometimes also cause a platelet aggregation in some species. Okay, so if you put the NSAID in, it's maybe prone to got the coagulopathy in hematotoxic snakes. So you're not supposed to use that.
All right, there's a next question from Ms. Kunab. Are there any possible recommendations for snake repellents that may be used in the household with pets and not hazardous to pets?
Okay, from snake farm, small experiment on the snake repellent, any substance that believed to expel the snake from the area, we never found that it's work. It's not work well. So it's like if we think more scientific about that, because if we compare to the insects like the mosquitoes, this the chemotactic animals is sensed by the chemicals. Okay, so the reptile is much more advanced than the insect. It is considered by brain, even it's not so smart. Okay, but it's not so based on chemotactic like that, so it's not work.
All right. I have a question. I just want to ask, is polyvalent antivenom have higher chances for anaphylactic shock compared to if we use a monovalent?
Actually, no study published about this yet, but we believe that it's not, because it's not different protein load for the patient. So it's no evidence that it has more chance. But on the other hand, the polyvalent antivenoms believed to have more benefit than monovalent antivenoms because of some synergistic effect of the many snake venom injected into one course. So it is a cover more wide range of the venom component. So sometimes we believe that the polyvalent may have more benefit than monovalent. But anyway, it's costly, it's more expensive.
Okay. There's another question from Charmaine. In the absence of the exact antivenom, is it worth it to try another?
To try another?
And yeah, if they do not know what type of snake and it
Yeah.
has shown clinical signs.
Yes, we can consider to do the symptomatic treatment. Okay, but and a lot of there are many ways to do the symptomatic treatment. It depends on the snake venoms. Think about the symptomatic treatment. Dr. Khaldun may has a little more experience on the symptomatic treatment because like the old stigmine or the tensilon test in the human, they also can adapt to use with the dog also.
Okay, I see.
So yeah, please ask Dr. Khaldun may add on this. What is symptomatic treatment without the antivenom?
Yeah, I mean, the only thing that we actually been using was new stigmine or tensilon test with hydrophonium maleate. But that's mainly only for the neurotoxic snakes, not for the hematotoxic snakes. So antivenom is much more preferred. For example, somebody got bitten by a Malayan pit viper and then bleeding from everywhere. So you can control for a certain period with blood products, but as long as the venom is in the circulation, the blood products will also be consumed. So what we need to do is actually basically neutralize the venom as soon as possible, and that's currently the only proven remedy is with antivenom. But for the neurotoxic, there's a competitive inhibition with the postsynaptic toxins in the, for example, cobra and also the king cobra, but not really for the other neurotoxic snakes, such as the kraits and sea snakes. So there are the slightly different consideration that you have to think about when you want to give other alternative therapy for neurotoxic envenoming, such as using the new stigmine, for example. We have done some given this medication for someone who get bitten by a cobra, not fully so-called back to normal power because of the paralysis. So we just give one shot of a new stigmine, and the patient, you know, almost immediately went back to normal power. And we actually top up with another dose, a smaller dose of antivenom to mop up the dislodged so-called venom from the binding sites. But these are all clinical observation. We don't really have you know, something to really measure and prove the amount of venom or the amount of antivenom or the amount of drugs that causes all this reaction to occur. So, but from clinical perspective, yes, we have seen marked improvement by using some of these drugs.
All right, thank you.
May I add on something to? Actually, the symptomatic treatment on the snake bite patients will based on this pathophysiologies. So let's say the cobra bite, the problem is the venoms will bind on the cholinergic receptor on the NMJ. So it's blocked the block is choline, the acetylcholine to bind on the receptors. So the key that that we always want to do is to use any drugs that prevents losing of acetylcholine. So in the case you know stigmine is the anticholine esterase to make the acetylcholine pool into that area and more chance to compete with the venoms. So that is one of the symptomatic treatment. But if let's say is more simple, we just look back to the important point of each snake venom. Like neurotoxin cause the systemic paralysis and the stop breathing. So the ventilator is a key factor to make the patient survive and wait until the venom was eliminated by the body system. So it just put in intubation and ventilator is maybe work, but not always. Okay, in severe case you need antivenoms. But in the hematotoxic venomous, the point will be depends on the coagulation factors. So we know that there's a lot of factors and different snakes will act on different factors. And when you got bleeding from your lack of that factor, you just refresh new one in by the whole blood given to the animals or the fresh frozen plasma that reach off the coagulation factor back into the body system and hope it works. As Dr. Khaldun mentioned, if the venom still in your blood circulation, the blood that you inject inside, the new blood inside also get destroyed. So you have to give more blood and blood donation in dogs is not very established like human. It's maybe not has that high benefit. Okay, so the antivenom still need, but if no antivenoms, you can consider the symptomatic treatment.
All right. We have a question from Wilson again. He's asking that should we give corticosteroids to reduce the swelling or effects caused by the snake venom?
The corticosteroid has no evidence that can reduce the swelling. So the swelling caused by the snake bites has a different mechanism from the inflammation. Because corticosteroid will reduce the swelling of inflammation, okay? But it's not by the snake venoms. Well, it's maybe because of permeabilities and also like the leakage of the blood or the plasma in the tissue. So the swelling will not subside by the corticosteroid. Okay, so the evidence that can reduce the swelling is two things. One thing is antivenom. Use antivenoms will reduce the swelling. And the second thing in human medicine is the elevation. You use the gravities to pull down the fluid and to pull the fluid down. But I have no idea how to lift the head into the dog head like this. So it's maybe difficult. So the antivenom should be the first choice to reduce the swelling.
Right. I have a question, sorry, because I've been treating quite a number of snake bite, because we usually give dexamethasone before I give anti-venom because I'm afraid of anaphylactic shock. Do you guys practice it in Thailand? And what is the rate that you give for the anti-venom if you're giving CRI?
Actually, some vet hospitals did that, but there's no evidence that it can prevent the reaction to the antivenom. Because until now, many studies cannot conclude that how we have the allergy to the antivenoms. It's for sure it's not past the IgE pathway. So the corticosterone has not confirmed its benefit, and maybe no need to inject this. So even the human medicine will treat the reaction when it's present. The human may also not pre-medicate, even for antihistamine or the dexamethasone. But if you have a reaction from the antivenoms, you can treat this as it has a usual allergy or the anaphylactic shock. So with the same dose. Is that answer?
Yes. What rate do you use to put the antivenom? Do you put it in like 100 mils of saline and let it flow, or you have to inject it slowly throughout a period of time?
For the vet, I think it can be both. It can be just a slow push IV, but you have to dilute it. Like one vials for 10 ml, you can dilute in the big syringe with the syringe pump, about 50 mils, something like that, and slowly push. The key is even you dilute into 100 mils, the first 15 minutes you have to use a really slow rate, and then if it has no reaction, you just increase the rate. Maybe it's 10 mils a day, very fast to finish as compared to the human. Okay, because when the dog reach to the hospital, it's the key that it has indication of antivenom. The rapid giving of the antivenom will have a chance that antivenom go to neutralize the venom in the bloodstream. So it's just 15 minutes slow to make sure that you have not reaction. And don't have reaction, you just increase the rate and finish it. For a dog, I think half an hour is enough to finish it.
All right, thank you for your answer. Okay, I have shared a link for another webinar by Dr. Khaldun on snake-related injuries in remote area. If anyone are interested, you can click onto the PDF file and onto the link. All right, okay, I have another question there. That's what is the first aid treatment for snake bites? But I believe we have answered that before this.
For human or for animals?
Yeah. Mr. Rao? Mr. Rao, can you?
Should be the
human.
Same.
Human.
That's, for humans, first aid is basically just to calm yourself down first, move away from the danger, and direct action will be to get to the hospital as soon as possible. So there's nothing need to be done.
Danger.
Yeah, do not suck the wound, do not tie the wound limb, do not apply anything. If it is bleeding profusely, and of course you can apply some cloth over the wound and compression, but otherwise we say just limit the movement of the limb that is affected and get to the hospital as soon as possible. So there's nothing that you do first aid that will let you stay home longer. So whatever it is that you do, you just get to the hospital as soon as possible. Be in a safe environment that we can monitor you, and we decide whether you are safe or not with the snakebite incident. Okay, you can get more information from the MST website. We have a lot of information for the public. So just visit the MST, Malaysian Society on Toxinology website. Okay.
All right, I think we are running out of time soon. We are actually over time. I'm so sorry for all the hiccups in the beginning. I'm sorry that I stuck in the traffic, so they have to wait for me. So we are a bit late on that. But thank you for joining us. Please be reminded there are eCert through the Google form that will be given in the link at the end of this webinar. And any of the vets that's joining us, if you are interested to participate in collecting data on snake bites, don't hesitate to contact me. I'm going to put in my email address over here. And also for vets, if you're interested in more of such a kind of a snake envenomation, not only snake, like even spiders or jellyfish, if you're interested in any webinar, you can always contact me and we see what we can do about it. So with that, I truly, truly appreciate Dr. Khaldun and Dr. Taksa. Thank you so much. Yeah.
And if you have a snake as a case, you can contact me also. Okay. I prefer to treat snake.
Okay, please make sure you click on the Google form link. I think maybe Dr. Norsham can share the link in the chat. Yes. Please just click on it and put in your details, what you want to, your name, as you want it to appear on the eCert, and answer the 3 questions. There are 3 questions, the quiz questions for you to answer. Otherwise, you will not get the eCert. Okay, get it answered correct. You can always go back and see the recording. We'll be putting up on YouTube, and the link will be shared on Facebook and also the MST website. Okay, so the eCert will be available also via the YouTube in the comment section, and it will be up for a limited time, I think until end of the month, by which you can still consider getting your eCert via the YouTube channel. Okay, I think with that, I pass it back to our 2 moderators, Melissa and Norsham, for your last word. Thank you and good night.
Thank you everyone for, yeah, Norsham, maybe you should speak.
Oh yeah. And before I pass it back to you, I'm just sorry, I think we missed some of the questions. So maybe those people that have not their question answered, maybe can send them by email, maybe? Is that possible, Melissa?
Yes, that's possible. So please email me at melissa@gmail.com if you have any further question, or for vets when you're interested to actually collaborate with us to collect data for a Malaysian snake bite cases in dogs. Thank you. Thank you so much, everyone. Bye.